fertility preservation techniques and procedures, sperm banking and storage. Introduction to sperm banking and storage. Sperm banking, cryopreservation, is a well-established technique for preserving male fertility by freezing and storing sperm for future use. It is widely used for both medical and non-medical indications and plays a key role in assisted reproductive technologies, RT. Key topics covered. What is sperm banking? Indications for sperm cryopreservation. Step-by-step process of sperm collection and freezing. Cryopreservation techniques, slow freezing versus vitrification. Storage, success rates, and ethical considerations. 1. What is sperm banking? Definition. Sperm banking is the process of collecting, freezing, and storing sperm for future reproductive use. This allows men to preserve their fertility in cases where their reproductive health may be compromised due to medical treatments, age, or other factors. Why is this important? Preserves fertility before medical treatments like chemotherapy. Ensures future reproductive options for men with declining sperm quality. Provides an option for men who may face infertility due to occupational hazards, surgery, or aging. Sperm cryopreservation is an effective and widely used technique with successful pregnancies, reported even after decades of storage. 2. Indications for sperm banking. 1. Medical indications. Cancer patients undergoing chemotherapy, radiation, which can cause sperm DNA damage or azoospermia. Before testicular or prostate surgery that may impair sperm production. Autoimmune diseases requiring gonadotoxic treatments, e.g., lupus, multiple sclerosis. Before gender-affirming treatments, e.g., hormone therapy or surgery in transgender individuals. Genetic conditions that may lead to early infertility, e.g., Klinefelter syndrome. 2. Non-medical elective indications. Men who want to preserve their fertility before age-related decline. Sperm storage for military personnel, athletes, or individuals with high-risk occupations. Men undergoing vasectomy who may want future reproductive options. Sperm donation for assisted reproduction, e.g., IVF, IUI surrogacy. Sperm quality declines with age and lifestyle factors, making sperm banking a viable option for long-term fertility preservation. 3rd step-by-step process of sperm banking. 1. Pre-banking evaluation. Medical history assessment to check for infections, genetic disorders. Semen analysis to evaluate sperm count, motility, morphology. Infectious disease screening, HIV, hepatitis, STIs. Sperm quality varies per sample, so multiple collections over several days improve preservation outcomes. 2 sperm collection methods. 1. Masturbation, preferred method, performed in a private collection room at a fertility clinic. Sample collected in a sterile container and analyzed immediately. 2. Post-ejaculatory urine collection, used for men with retrograde ejaculation where sperm is found in urine. Urine is processed to extract sperm for cryopreservation. 3. Electroejaculation, used for men with spinal cord injuries or neurological conditions that prevent ejaculation. Mild electrical stimulation is applied to stimulate ejaculation. 4. Testicular sperm extraction, TESE, or micro-TESE, used when no sperm is found in ejaculate, azoospermia. A small testicular biopsy is performed to extract sperm. The choice of method depends on the individual's medical condition and ability to provide a sample naturally. 3. Cryopreservation of sperm. Once collected, sperm samples are processed and frozen using one of two methods. 1. Slow freezing, older method. Stepwise cooling of sperm at controlled rates reduces sperm metabolism to prevent damage. Lower survival rates compared to vitrification. 2. Vitrification modern method. Ultra-rapid freezing technique using cryoprotectants. Prevents ice crystal formation, improving post-thaw sperm's survival, higher success rates, and better motility retention. Vitrification is now the preferred method due to its improved sperm survival rate, approximately 70 to 80%. 4. Storage and future use of frozen sperm. How long can sperm be stored? Sperm can be stored indefinitely in liquid nitrogen, minus 196 degrees Celsius. Pregnancies have been reported from sperm stored for over 20 years. How is frozen sperm used? Intrauterine insemination, IUI, direct insertion of sperm into the uterus. In vitro fertilization, IVF, sperm is used to fertilize an egg in the lab. Intracytoplasmic sperm injection, ICSI, a single sperm is injected directly into an egg. Success depends on sperm quality, freezing method, and female partner's reproductive health. 5. Risks and ethical considerations. 1. Risks of sperm banking. Not all sperm survive the freezing and thawing process, approximately 50 to 70% survival rate. Sperm DNA fragmentation can occur in some cases. Storage and maintenance costs may be high for long-term preservation. 2. Ethical considerations. Informed consent. Patients must consent to how their sperm will be used. Posthumous sperm use. What happens if a man passes away before using his frozen sperm? Sperm donor anonymity. Ethical concerns regarding disclosure of sperm donor identity. Legal aspects. Different countries have regulations on sperm storage duration and usage. Ethical guidelines ensure that sperm banking remains a fair and transparent process. Summary. Key takeaways. What is sperm banking? A technique to collect, freeze, and store sperm for future reproductive use. Who needs it? Medical reasons: cancer, surgery, autoimmune diseases, genetic conditions. Non-medical reasons: career planning, sperm donation, military or high-risk occupations. Key steps in the process: collection via masturbation, electroejaculation, or testicular extraction, TESE. cryopreservation using slow freezing or vitrification, long-term storage in liquid nitrogen, success rates and risks. Sperm survival after thawing, approximately 50 to 70%. Higher success rates with vitrification. Storage can last for decades without quality loss. Ethical considerations, consent, posthumous use, and regulations must be clearly defined. Final thought: sperm banking is an effective fertility preservation option with long-term viability, providing reproductive options for men facing medical or personal fertility challenges.